Good morning, Keller Williams. Scott said the other day, he said, you're getting very comfortable doing these, and it's probably something that will continue long into the future because we have no idea what our new normal is. But I want to welcome 60 people who are on. We're missing about another 66. So I guess we'll send a note out for in the future that we are continuing to do these on Tuesdays and Fridays. So if you see any of your colleagues out there, this Tuesday we're going to give you the update on COVID, and then we're going to bring Carrie, the team leader, into the picture, and she's going to do the sales meeting and give you some results of how we are doing as a company up until the end of April. So let's get into the COVID-19 report. So businesses are urged to get ready for a reopening soon. The province will announce this week when businesses can reopen. I think that may be coming later today, if not by Wednesday of next week. And the Premier said, I have been encouraging business for weeks to prepare for the new normal and reopening. Almost 2 weeks after he announced the various phases of an economic recovery plan. The next phase, which will allow many businesses to reopen with controls, was to start 2 to 4 weeks after the plan was revealed. We are days away, and I'm asking you again to plan and prepare, Higgs said. Determine how long you can operate within the public health guidelines of physical distancing, cleanliness, and hand washing. So we went about 17 days with no COVID-19, and this week we had 2 active cases. So we still have the 2 active cases. They're both in self-isolation. 118 has recovered, nobody in the hospital, and nobody in ICU. We've tested probably 2.2% of the population, which is over 16,625. I'm not sure why the numbers are slower. I think that we should just start, anyone that's walking on the street, start testing them and get the numbers up. Let's see where we're going here. So, Keller Williams, we are preparing to open all the Keller Williams offices to agents only, with the following measures strictly implemented. All printable versions of the following signs will be made available, and they will be very visible in all market centers. So when we say agents only, that's exactly what we're saying. For some offices, and I'll use the office of Bathurst as an example, because of the space allocation in Bathurst, there may be a need to determine how many agents can be in that office at any one time. Gail will be back at the office. We've got her area taped off, which is going to be her self-distancing space, and the agents will not go over the line, I guess. But we're gonna monitor this. So right now, Gail will be in the office. All of the office will be closed to the general public. There'll be no clients of anyone's meeting at the office. So as we look at this, Keller Williams will be following the guidelines recommended by the New Brunswick government to safely begin to open in stages with a focus on safety and awareness. Our first stage will allow agents only in the office. should not be served as an open invitation to gather in the office, and working from home is still the safest option. So we will have the operational plan will include COVID awareness signage, pre-screening tool signage and placement, physical distance guideline in the office, cleaning and disinfecting procedures, facilitating personal hygiene etiquette, and personal protection equipment. So if we look at the first one is the the one that's done for public health, protect yourself and others. It should be posted near the entrance of all offices in a high traffic area, and it talks about protect yourself from others in regards to washing your hands, sneezing in your elbow, avoiding touching your face, cleaning all surfaces, cough into tissues, stay at home if you're sick, avoid contact with sick people, and physical distancing. The pre-screening sign should be posted in all exterior office doors to be observed by all agents before entering the Keller Williams office. If you answer yes to any of the questions, please do not go in the office. So these signs that are asking the questions, do you have any symptoms associated with COVID-19, cough, fever, difficulty breathing? Have you been diagnosed with COVID-19 or currently pending test results? Have you been in contact with any person who has been diagnosed with COVID-19 or currently pending test results? And have you traveled or been in contact with anyone who has traveled outside the province of New Brunswick in the last 14 days? If you answer yes to any of those questions, you cannot go into the building. So, physical distancing. In the office will require all agents to maintain 6 feet of distance from each other and will require the wearing of masks in situations where this might not be possible. Meeting in a small closed office, agents should not concentrate in areas unnecessarily, i.e., waiting at the printer or the photocopier. Take turns, it's safer and doesn't require wearing a mask. Again, if I use the Bathurst office, a little bit difficult. You got 5 or 6 agents in that room. Doing a physical distance is 6 feet. My recommendations for, particularly for the Bathurst office, is that you guys need to determine at the number of how many can be comfortably put in there and be able to work. And you may also decide that you're going to wear a mask full-time while you're in that particular office. And I know I'm going to get questions after this from Bathurst, but I think this is the safest way to do what we're doing. So cleansing and disinfecting procedures. So know the difference between cleaning, disinfecting, and sanitizing. Cleaning removes the germs, disinfecting kills the germs, and sanitizing lowers the number of germs. So for agents working in the office, you are responsible to clean and disinfect the areas that you occupied before you leave. Supplies will be provided to do so. High traffic areas will be cleaned and disinfected throughout the day. So those people that do not have an office and are using the common area or the bullpen or wherever you sit down for 5 minutes, 10 minutes, or 2 hours before you leave, you need to wipe down the area that you've been in. Otherwise, you're going to put the onus on the staff to ensure that it's clean. The staff will make the necessary go-throughs in the office to clean, disinfect doorknobs, light switches, the printer from time to time throughout the day, but whatever space that you occupy, that's what you'll be responsible to clean. The offices that have training rooms are closed. It's not a place to go sit and do your work. We're going to close that whole thing down, because if one person goes in the training room and you sit in one space, before you leave, we got to clean that entire training room. That's the protocol, and that's what Department of Health is suggesting. So I hope that this clearly indicates where we're going here. Do you have these slides on there as well? Okay, so facilitating personal hygiene. This sign will be have similar messages, should be displayed in all washrooms, encourage proper hand washing, and hand washing at all times. And they always say, wash your hands frequently. Hand sanitizer sign will be posted. All hand sanitizer station locations in each office. Hand sanitizer will be provided and should be used regularly to prevent community spread in the office. Now, we bought some hand sanitizer yesterday from a distillery. So when we got the bottles, it came in vodka bottles, but don't get excited, it's not vodka. It is hand sanitizer, and we're actually looking to find some pumps and bottles that we can pour this stuff in, and we can use it. So we'll get that out to you in the next couple of days. Personal and protection equipment. We recommend the use of masks when physical distancing is not possible. Appropriate use of non-medical masks or face covering. Now, there's been a lot of debate on the public health, and nurses that we know who've been in the field for a very long time. Some people think because they have a mask on their face that they're safe, and sometimes it gives people the sense of false security. When worn properly, a person wearing a non-medical mask or face covering can reduce the spread of his or her own infection respiratory droplets. Non-medical masks or face covering should allow for easy breathing, fits securely to the head with ties or ear loops, maintain their shape after washing and drying, be changed as soon as possible if damp or dirty, be comfortable and not require frequent adjustment, be made at least 2 layers of tightly woven material fabric such as cotton or linens, be large enough to completely and comfortably cover the nose and mouth without gaping. Some masks should include a pocket to accommodate a paper towel or disposable coffee filters for increased benefit. Non-medical masks or face coverings should not be shared with others, improper vision or interfere with tasks, be placed on children under 2 years old, be made of plastic or other non-breathable materials, be secured with tape or other inappropriate materials, be made exclusively of material that easily falls apart, such as tissue, be placed on anyone unable to remove them without the assistance or anyone who has trouble breathing. The other important thing about masks is this, is that if you have a mask on and you touch your face and you touch that mask, you've ruined the mask. Number one, you need to change the mask, and number two, you need to go wash your hands. And that's sometimes the false security that you have, because you got a mask on, you can touch your face and do everything. The important part of all of this is being able to not touch your face at any time. So these are going out. It's what I call, and what Scott and I call, a soft close or a soft opening. we want to make sure that our people, that our staff is in there and get them regimented into the new normal for a couple of weeks, and then we'll make another announcement to open up a little bit further, and hopefully within the next month and a half, we'll be back to whatever this new normal is. I was invited by the NBRA, who's having a meeting with the government to look at what the new normal is going to be going forward in reopening, and I've asked Chris Constantine to sit in on that meeting to represent Keller Williams, and I think that Chris will do a very good job at that. So when we look at the technology, innovate, automate, and dominate, we look at the TAPS audit. I think we're down to 7 people that are remaining, 5 in Moncton, 1 in Woodstock, and 1 in Grand Falls. They will be done probably by Wednesday of next week. And then on Friday, as I give you the update on COVID, David may be in a position to give a full overview, and we'll bring him on and he'll give you a full overview of his Porta findings and some direction of where we're going with the education around all of this great technology that we have. One of the things I know that over the last 8 weeks, we've used technology here in the office that we've had here for quite some time, and I think that I'm getting kind of used to being able to talk to potentially 136 agents at one time around the province. So I think this setup that we have going out of COVID-19, we'll probably use this as often as we have to in regards to making sure that all of you get all of the information on a timely basis, and this way we give it to you once and everybody gets it. So we're going to use this. And on Tuesday, we're going to use the same procedure, and then we're going to draw Carrie into it. She'll be out in Moncton, but we'll draw her into it just like we did the 2 guests that we had last Friday and the Friday before. So everything is moving ahead. Very encouraged by the numbers that Carrie will talk to you about on Tuesday. We're doing very, very, very well. I think that the reason why we're doing as well as we are is because we have great people that are doing real estate in business as usual in an unusual manner. But I also think that we're doing very, very well because your leadership has poured into you over the last 8 weeks like no other that I believe. And as a result of that, and as a result of you taking the initiative to work in and on your business over the last 8 weeks, when this COVID-19 is opened up so more business can get out and more people can get out and do what they're doing, we will be at an advantage over every other real estate company in the province of New Brunswick. I firmly believe that, and the numbers that I looked at as of the end of April certainly indicates that to us. So get ready. Your end of spring market and your beginning of summer market is about to pounce upon you. If you were busy over the last 8 weeks, you're going to get busier. If you weren't as busy, get ready because you can get busier. And always know that Keller Williams, you're our partners. You're not salespersons. You're not just sales agents. You're our ears, you're our eyes, and you're our partners across this province. And Scott and I and the rest of the leadership could not be prouder to be in business with each and every single one of you. If you have any questions, any concerns about what we talked about this morning, I'm just a phone call away. I'm an email away. Scott is the same thing, and we're here to provide you with the best leadership that we can provide to ensure that you can live life by design. Thank you very much, and in closing, I would just like to say this weekend's a special weekend for mothers. Happy Mother's Day to all the mothers out there. Happy Mother's Day to the expectant mothers, if there's any. And love on your mothers, because without them, all of us wouldn't be here. Thank you.